So I will focus on hospitalizations this morning. As we've said previously, as time goes by, the number of detected and reported cases becomes less relevant and a poorer indicator of what's happening in the community, and hospitalisation becomes more relevant and interesting. And there are some interesting trends we're observing here. There are 21 patients in Queensland hospital intensive care units, of whom 7 are currently ventilated or ventilated as of 7 p.m. last night. And there are 419 cases in hospital requiring treatment for COVID-19. This latter number is steady. The intensive care number, overall, that's still a small number by Queensland standards. The overall hospitalisation rate, particularly the ward rate, is increasing steadily. And as I mentioned yesterday, we expect that rate to increase significantly in the next week or thereabouts. Sometime this week, we think that number will start to escalate significantly. A particularly interesting observation is that a substantial number of the cases are occurring on the Gold Coast. About half of the intensive care admissions, or just over half, 11 out of the 21, and about a quarter of the ward admissions, 101 out of 419, are currently on the Gold Coast, suggesting that there is a significant surge of the virus there on the Gold Coast. We've said from the beginning that this epidemic would not occur in an even spread at all at the same time across Queensland, and it looks like at the moment the surge is probably occurring on the Gold Coast. It's not surprising given the sheer number of interstate visitors which would have caused seeding events to have occurred, particularly in this area, because we know we have a lot of travellers going to that region. But I would also point out that the vaccination rates on the Gold Coast are among the low end, I think the lowest in southeast Queensland at least. So I would certainly encourage every Queenslander to get vaccinated, obviously. I would particularly encourage people to get those boosters. Those boosters are really critical as we go forward, and I can't overemphasise that. That's for those who've had their last dose of the vaccine more than 4 months ago. I was asked yesterday about vaccinations. I can get some specific in the hospital. I just got some specific interesting information from, say, the Gold Coast Intensive Care Unit, which has the 11 inpatients. Just remembering, so there are 21 inpatients across Queensland in intensive care units. 11 of them are in the Gold Coast. There are just 10 outside the Gold Coast in intensive care. But of those 11 in the intensive care unit, 6 are unvaccinated, and they have classical COVID pneumonia of the type we saw in the pre-vaccination era, which seems like a long time ago to me now, but that similar sort of clinical picture to what we saw in New York and in Rome and in Melbourne, all that long before vaccinations exist. And it's hard to believe, in my mind, how you could still be unvaccinated now in the middle of a pandemic. But yes, we have of those 11, 6 are unvaccinated. Of the 5 others, they were double vaccinated, but all had complex other medical issues that were mixed in with the cause for their intensive care admission. And when I say complex, I'm talking about 2 of them had head injuries plus COVID. One had a big stroke plus COVID. One had a major seizure disorder and a long-term brain injury plus COVID. So those were the vaccinated ones in intensive care unit. The ones with classical COVID, what I call old-fashioned COVID pneumonia, were all unvaccinated, and none of those patients had received boosters. It's also interesting as over the last few days, the proportion of Omicron is increasing. We're now sitting at around about 90%. It's completely dominating all other viruses here in Queensland. So what we're going to see in Queensland is which is quite unique, is an Omicron pandemic, and it'll be interesting to see how that differs from what has been seen elsewhere. Omicron definitely can still cause severe disease. It's not trivial. The main reason why we're not seeing huge numbers of intensive care admissions, the main reason is because of our high vaccination rate. It's not because it's Omicron. Omicron can definitely put you into intensive care unit if you're not vaccinated.